This video continuation of carbohydrate metabolism disorders. Already first disorder glycogen storage disease completed. This one is the second disorder pyruvate kinase deficiency. Pyruvate kinase deficiency is an autosomal recessive disorder which occur due to mutation of PKLR gene located on chromosome 1q21 coding for the enzyme pyruvate kinase. Pyruvate kinase is the enzyme in glycolytic pathway which help in the transfer of phosphate group from phosphoenol pyruvate to adenosine diphosphate molecules ADP, resulting in that formation of pyruvate and ATP. So this kinase, pyruvate kinase enzyme in glycolytic pathway help in transfer of phosphate group from phosphoenol pyruvic acid to ADP molecules, resulting in the formation of pyruvate. So pyruvate and ATP. This deficiency is mainly seen in erythrocytes. Leading to hemolytic anemia. This deficiency leads to hemolytic anemia. 90% of energy in erythrocytes come from glycolysis. 90% of energy comes from glycolysis. Mature erythrocytes lack nucleus and mitochondria. Without the nucleus, they have no ability to synthesize new protein. So without nucleus, they don't have ability to synthesize new protein for formation of enzyme. Without mitochondria, erythrocytes are dependent on the anaerobic generation of ATP during glycolysis. So here without mitochondria, erythrocytes are dependent on that anaerobic generation of ATP during glycolysis with insufficient ATP, all active process in the cell are disturbed. Sodium potassium ATPase pump are the first to stop. Sodium potassium ATPase pump are the first to stop. Potassium leak out of the plasma membrane, leading to a hypotonic intracellular fluid. This causes water move down concentration gradient out of cell, causing the cell to shrink and then die. This causes hemolytic anemia. So here sodium potassium ATPase pump first to stop. Then so potassium leak out, leading to hypotonic condition. So a hypotonic intracellular fluid, this causes water to move down concentration gradient out of the cell, causing cell to shrink and die. This causes hemolytic anemia. Hepatic pyruvate kinase is also coded by the same gene but do not show any effect as liver cell have mitochondria. Hepatic pyruvate kinase also coded same gene but not show any effect because liver cell having mitochondria and they can generate ATP through oxidative phosphorylation process. So they generate ATP by oxidative phosphorylation. Next is sign and symptoms. It causes jaundice, fatigue, lethargy, pallor, enlargement of spleen, mild or severe hemolysis causing anemia, jaundice and anemia in newborn. Then diagnosis, molecular genetic testing to detect mutation in PKLR gene. Molecular genetic testing to detect mutation in PKLR gene. Measure the activity of enzyme pyruvate kinase in RBC. Low activity indicate disorders. Lab test to detect anemia. Molecular genetic test, then measure that activity of enzyme pyruvate kinase, then lab test to detect anemia. Next treatment, blood transfusion in severe anemia condition, then splenectomy, then phototherapy in newborn, then hematopoietic stem cell transplant, then gene therapy. What are the treatment used for pyruvate kinase deficiency? Blood transfusion in severe anemia cases, then splenectomy, phototherapy, hematopoietic stem cell transplant, then gene therapy. Defective gene is replaced with the normal gene to enable the production of the active enzyme. So here replacing defective gene replaced by normal gene. Third condition, pyruvate dehydrogenase deficiency. It is an autosomal recessive disorder that occur due to mutation of PHA BDHA1 gene coding for the enzyme pyruvate dehydrogenase. Here mutation in PDHA1 gene coding for enzyme pyruvate dehydrogenase. It is a neurodegenerative disorder. Pyruvate dehydrogenase is an enzyme in TCA cycle. It is an enzyme in a TCA cycle that help in the conversion of the starting substance pyruvate to acetyl coenzyme A. The deficiency of this enzyme causes pyruvate to build in that cell. Since acetyl coenzyme A is not formed, the body cannot go through TCA cycle and the body does not get enough energy. The pyruvate that is built up in the cell get converted to lactic acid, which enter the bloodstream and causes acidosis. So here pyruvate dehydrogenase is the enzyme of TCA cycle. Help for conversion of that starting substance pyruvate to acetyl coenzyme A. Here this one conversion is not happen. Pyruvate is built in the cell, get converted into acetic acid, which enter the bloodstream, causes acidosis. This condition is seen in early infancy and childhood stage only. Infancy and childhood. Then what are the signs and symptoms of pyruvate dehydrogenase deficiency? Abnormalities at infancy, low birth weight, narrow head, prominent forehead, wide nasal bridge, then low muscle tone, poor feeding, extreme tiredness, rapid breathing, abnormal eye movement, and seizures. These are the signs and symptoms in infancy. Then fetal abnormalities, poor fetal weight gain, low level of estrol in mother urine, estriol in mother urine. Symptoms include nausea, vomiting, breathing problem, abnormal heartbeat. Ataxia may be seen in less severe cases of lactic acidosis due to stress or consuming high amount of carbohydrate. High level of ammonia in blood causes confusion, weakness and fatigue. A diagnosis brain MRI, blood test to measure lactic acid or pyruvate, test to measure level of lactic acid or pyruvate in cerebrospinal fluid, then blood test or urine test to check that level of amino acid, alanine and genetic test. So these are the tests: brain MRI, blood test, urine test and genetic test. Treatment: supplementing cofactor thiamine. So supplementing cofactor thiamine, carnitine and lipoic acid. Then dichloroacetate medication may help some patient with phosphate dehydrogenase deficiency, followed by ketogenic diet with more fat and low carbohydrate medication to prevent seizures. So treatment: supplementing cofactor thiamine, carnitine, lipoic acid, then dichloroacetate, then ketogenic diet and medication to prevent seizures. Fourth condition, glucose 6-phosphate dehydrogenase deficiency. Glucose 6-phosphate dehydrogenase deficiency is an inherited X-linked recessive disorder. X-linked recessive disorder that occur due to mutation of glucose 6-phosphate dehydrogenase gene coding for the enzyme glucose 6-phosphate dehydrogenase. It occurs mainly in male as it is X-linked. Glucose 6-phosphate dehydrogenase enzyme play a important role in normal metabolism of carbohydrate, and it is a critical role in protecting RBC from damage and premature destruction. Glucose 6-phosphate dehydrogenase is responsible for the first step, glucose 6-phosphate to 6-phosphogluconolactone in HMP pathway, a series of chemical reactions that help in the conversion of glucose to ribose 5-phosphate. It is the rate limiting enzyme in this pathway. HMP pathway play a important role in production of NADPH. This NADPH protect the cell from reactive oxygen species which is produced during normal chemical reaction in the body. Reactive oxygen species are toxic if they get built up within the cell. So NADPH produced by glucose 6-phosphate dehydrogenase is essential for red blood cell to protect them from damage by reactive oxygen species. The red blood cells do not have any other enzyme that help in production of NADPH. Sign and symptoms. Symptoms occur only when the person red blood cells are exposed to certain chemicals in food or medicine, a sudden bacterial or viral infection, or because of stress. The most common medical problem that occur in hemolytic anemia, main problem hemolytic anemia, paleness, yellow of skin and eyes, dark urine, fatigue, shortness of breath, enlarged spleen, rapid heartbeat, dizziness. Diagnosis: blood test to check level of glucose 6 phosphate dehydrogenase enzyme, complete blood count, serum hemoglobin test, reticulocytes count. Then treatment: avoid agent that trigger an attack, blood transfusion in hemolytic anemia, then treat if any underlying infection. Last condition, diabetes mellitus, is a group of metabolic disorder characterized by hyperglycemia resulting from defect in insulin secretion. The high blood sugar produce classical symptoms of polyuria, polyphagia, polydipsia. It is a chronic lifelong condition and one of the leading cause of death. Insulin is the hormone secreted by beta cell of islet of Langerhans of pancreas, which help to lowering blood glucose level after a meal. It has many functions that help in maintaining the blood glucose level within normal range, which are as follows. What are the functions? It lower blood sugar level by promoting utilization and storage of glucose. Then it is required for uptake of glucose by muscles, adipose tissue, leukocytes and mammary gland. It increases glucolysis in muscles and liver. It activates the enzyme of glycolysis, glucokinase, pyruvate kinase, phosphofructokinase. It helps glucogenesis, glycogenolysis, stimulates synthesis of triglycerol. It prevents breakdown of fat and release of fatty acid. It helps in protein synthesis. Now classification. There are 4 types. Type 1, it is also called as insulin dependent diabetes mellitus. Type 2, non-insulin dependent diabetes mellitus. Third one is gestational, during pregnancy period only. Type 1, it results from body failure to produce insulin. The glucose is not able to enter the cell due to lack of insulin, causing condition name is called hyperglycemia. It occurs due to destruction of beta cell. This one occurs due to destruction of beta cell of pancreas due to sudden drugs or virus or autoimmunity. It is also called as juvenile diabetes. It is seen in young children. Second one is non-insulin dependent, occur 80 to 90% in diabetic population. It results from insulin resistance, a condition in which cell fail to use their destruction here fail to use insulin properly. Causes may be genetic or environmental. It is usually seen in adult. It is a progressive disease that worsen over a period of time. It is a progressive one. Then during pregnancy period, pregnant woman without a previous diagnosis of diabetes. Sign and symptoms: polyuria, polytrypsia, polyphagia, unexplained weight loss, fatigue, blurred vision, dry and itching skin. Complications: heart disease, heart attack, stroke, neuropathy, nephropathy, retinopathy, bacterial, fungal infection, hearing loss, dementia. Then treatment and management: consume low carbohydrate, take high protein and fiber rich diet. Exercise, weight management to prevent obesity, hypoglycemic drugs, insulin administration, monitor the blood sugar level. Test for diabetes: fasting normal 70 to 110. Fasting, it is a screening test. Blood sample taken after a fast of 8 hours interval. Pre-diabetic condition 101 to 125. Diabetic more than 126 mg per deciliter. Then random RBC, this one 200 mg per deciliter. Higher means diabetic condition. Post prandial glucose level after glucose load normal less than 140 mg per deciliter. Other test: HbA1c test, glycosylated Hb test or A1c test, normal less than 5.7, pre-diabetic 5.7 to 6.4, diabetic condition more than 6.5. Then urine test, in this one microalbumin and ketone test we are using. Other blood test: lipid, liver function test and kidney function test. Then one more important test: oral glucose tolerance test. So by using these are the tests we can detect diabetes mellitus condition. Thanks for watching.